We've all been there. You need to see a doctor, and just booking the appointment feels like it requires a master's degree in patience. It's got to be one of healthcare's biggest, most universal headaches, right? But what if I told you technology is finally providing a cure? Let's get into it. Seriously, just think about it for a second. The last time you had to do it, was it a smooth, easy, one-click kind of thing? Or was it a frustrating nightmare of phone menus, endless hold music, and playing phone tag? Yeah, for most of us, the answer is pretty obvious. The old way is just, well, it's a mess. You're stuck calling only between 9 and 5, waiting on hold for what feels like an eternity, only to find out the next open slot is 3 weeks from now. Then you finally get there, and you're waiting another hour because of some scheduling mix-up. This whole manual, paper-based system is just asking for mistakes, and it really wasn't built for the way we live today. But that entire frustrating experience is being completely turned on its head. We're finally moving away from that physical front desk and into the digital doctor's office. So, what exactly is a smart healthcare appointment system? Well, think of it like a central command hub that automates the whole scheduling mess. It uses apps and websites to plug you directly into a clinic's calendar, giving us the power to book, reschedule, or even cancel an appointment anytime, day or night, from wherever we are. And believe me, this has been a long time coming. I mean, we went from giant paper ledgers back in the 50s to that clunky desktop software in the 90s, and then to those pretty basic web forms about a decade ago. But the jump from then to now, it's huge. We're talking about smart, AI-powered systems that don't just schedule things, they actually optimize them. And the impact is what makes this a real game changer. This isn't just about a little bit of extra convenience. It's a win for patients, it's a win for doctors, and it's a huge win for hospitals and clinics. It really helps everybody. Okay, so get this. One of the biggest money wasters in healthcare is no-shows. People just not showing up. It wastes the doctor's time and costs clinics a ton of money. But with these systems sending out simple automated text and email reminders, they can cut those no-show rates by up to 30%. That's not a small number, that's a really big deal. And what about the folks working at the clinic? Can you imagine freeing up 90% of the time your staff spends on the phone just juggling schedules? That's what this kind of automation can do. It gets rid of all those repetitive admin tasks and lets nurses and receptionists focus on what really matters, taking care of patients. And for us, the patients, the numbers are just as powerful. Nearly 70% of us are more likely to pick and stay with a doctor who offers easy online scheduling. In today's world, that kind of convenience isn't just a nice little perk anymore, it's what people expect. So let's just lay it all out, right? For patients, it's all about convenience and having more control. For doctors, it means their schedules are way more efficient, they have less paperwork, and they can see a patient's history in a flash. And for the hospitals, they see a massive jump in efficiency, which means more revenue and a smarter way to use their staff and resources. It really is a system-wide upgrade. Okay, so this all sounds amazing, but what's the actual magic happening behind the screen? How does all this tech really work? Let's pull back the curtain a little bit. You can really think of it in 3 simple parts. First, you have the front door. That's the slick, easy-to-use app that you interact with. It's built to be so simple that booking an appointment feels as easy as ordering a pizza. Then, behind that, you've got the brain, the smart scheduling engine. This is where AI is working overtime, looking at the doctor's entire calendar, finding the best open slots, and making sure nobody gets double booked. And finally, and this is probably the most important part, you have the records room. This is a super secure digital vault where all your private health information is locked down with multiple layers of security, making sure it stays safe and confidential. And what's really cool is that these platforms are becoming so much more than just booking tools. A lot of them now have telemedicine built right in, so you can do a virtual visit. They handle payments securely. Some even use AI triage. You can describe your symptoms, and it'll suggest if you need a general doctor or a specialist, saving you a whole step. And get this, some are even using connected devices, the Internet of Things, to do things like automatically check you in the second you walk in the door. So, where do we go from here? The technology is obviously incredibly powerful, but rolling it out everywhere, well, that comes with its own set of challenges. Of course, it's not all easy. Things like data security are a huge deal, and trying to get brand new tech to work with ancient hospital systems can be a real nightmare. But the good news is, for every one of these hurdles, there are innovative solutions popping up. For instance, people are looking at things like blockchain, which is like a super secure, unchangeable digital ledger to create basically hack-proof patient records. And the industry is starting to agree on open standards so that all these different systems can finally talk to each other without a problem. You know, this quote just absolutely nails it. This whole technological shift isn't just about making things more convenient. It's about a fundamental change in how we think about healthcare, moving away from a model that's centered on the hospital to one that's truly centered on the patient. And look, this isn't just some theory about the future. This stuff is happening right now. A company called Practo has totally changed how people find and book doctors all across India. Luma Health uses AI to automatically fill a canceled appointment slot in minutes, a job that used to take staff hours of phone calls. And there's even specialized AI, like Pax Fidelity, that's optimizing really complex scheduling for things like MRIs, and it's boosting how many can be done by 16%. So the technology to get rid of the waiting rooms, the hold music, and all the scheduling headaches, it's not science fiction. It's already here, and it's proving how valuable it is every single day. So the real question we have to ask ourselves is, how quickly will our own doctors and hospitals get on board?